Hi, I'm Martha Cannon. I'm a Royal College specialist in feline medicine from the Oxford Cat Clinic, and welcome to these recordings. Today's course looks at various aspects of infectious disease in cats, covering areas which have new developments either in diagnostics or treatment, and areas where there's a room for confusion in interpretation of diagnostic test results. So we're going to look at FIP, which has come on leaps and bounds in recent times in terms of diagnosis, but very excitingly also now in terms of treatment. We have an effective treatment for FIP, which is obviously revolutionary. We're going to look at mycobacteria, TB in cats, which is not common but is increasingly recognised and can be very problematic in terms of diagnosis and concerns about the ethics of treatment and the zoonotic potential. So we'll look at those aspects. We're going to look at cat flu viruses and the wide range of different problems that they can cause beyond the standard cat flu presentation, looking at ways that we can treat them, and indeed we'll look at current recommendations for vaccination against cat flu but against the range of cat diseases, looking at how we can find ways to give the maximum number of cats the benefit of vaccination but also not over-vaccinate individual cats. And then we'll also look at infectious aspects of diarrhea and how we interpret fecal panels, what agents are relevant, which ones perhaps are not relevant even though they're in the panel, and how do we approach the management of diarrhea in cats and kittens, and also a wider discussion of some of the infectious causes of lower respiratory disease, so that's coughing cats, lung disease, pneumonia, lungworm, and mycobacteria. So I hope it will be useful. I hope there will be some new elements and that it will clarify some of the areas of confusion that still relate to those areas. So coronavirus, we know, is very, very common in the pet cat population, always has been, probably always will be. And in most cases, infection is short-term. It doesn't cause any clinical signs at all. No one would be aware of it, and indeed many breeders and owners of multi-cat households are completely unaware that they have coronavirus in their population and get very upset, frustrated, disbelieving when they suddenly discover that it is there and probably has been there for a long time. So the vast majority of cats, it will do nothing. It has been labelled as a cause of diarrhea, and we'll come back to this one a little bit when we talk about infectious causes of diarrhea. But this is again a potential source of confusion. It can, because it's an enteric, the normal coronavirus is an enteric infection. It lives in the gut. It can cause mild self-limiting diarrhea when a cat first is infected. But it is a mild, short-term acute diarrhea, such as we very commonly see in kittens, that settles itself down within a few days and really doesn't cause too much issue. It's not a cause of chronic diarrhea. We'll come back to that later when we come to that topic, but it's on all the panels for diarrhea, but it isn't a cause of chronic diarrhea. So, it really is a mild self-limiting thing. And as we know, only a small minority of infected cats will develop FIP. How many cats with coronavirus will develop FIP? Again, debate rages and different studies find different levels, but essentially it's a situation where the risk for an individual cat wholly depends on the environment that cat lives in, how old it is, how many other cats in the environment, its own immune system, all of those factors. So I don't think it's really helpful to have a number that says 5% or 7% or 10% or whatever, because it's what an owner wants to know is what's the risk for my particular cat, not what's the risk for every cat in the world who's got FIP. So I don't think we need to get too hooked up on the numbers, but basically that it's rare for a cat with coronavirus to develop FIP, but of course when it happens it's very significant. So we know that coronavirus is highly transmissible. In the case of the feline coronavirus, it's an enteric infection, so it's feco-oral transmission. So it's shed in the feces, and then it's picked up by other cats when they either share the litter tray or they get the litter dust on them and then they groom themselves and so on. And again, as we know, one of the big conundrums about coronavirus and FIP is that we know it's highly transmissible. We know if one cat in the household has it, they will all have it. but we also know that hardly any of them, if any of them, will go down with FIP. And if one cat does go down with FIP, it does not put the other cats in that household at higher risk of FIP, although obviously owners find that a very difficult concept to grasp. And again, first myth-buster of the day, coronavirus does not cause chronic diarrhea, even though that has kind of got into the zeitgeist, if you like. Okay, so FIP occurs when this non-pathogenic, asymptomatic, enteric coronavirus mutates into a pathogenic form of the virus. And three things are needed in terms of this, this mutation in order to produce FIP. So it's not as simple as it's not as simple as getting a mutation that allows the coronavirus into the systemic circulation and then the rest is inevitable. The mutation needs to allow the virus to get into macrophages, but also to survive in macrophages, because obviously macrophages are designed to kill viruses. So many times when the virus gets in, the macrophage just does its job. So it needs to be a mutation that allows it to survive in macrophages and critically to multiply in macrophages. And that's where when it sets up some local inflammation and macrophages are recruited, it's able to multiply, spread, build up and generate the cascade of inflammatory changes which are FIP. So invade, survive and multiply in the macrophages. And once it can do that, then it has access to the general systemic circulation. So non-pathogenic coronaviruses in the enterocytes, shed in the feces, highly contagious. Occasional non-pathogenic coronaviruses invade and survive in macrophages and even get into the circulation. But if they can't replicate in macrophages, the viral level in tissues will be very low and not high enough to trigger the whole cascade of FIP.